Hello everyone. We have a 21-year-old male. He come to emergency department with a 6-week history of progressive shortness of breath and cough. He wheezes at night and has to sit up to relieve his chest discomfort. There is no other medical problem. And CT of the chest reveals a mediastinal mass compressing the trachea. Serum alpha fetoprotein and beta human chorionic gonadotrophin, that is beta HCG level are increased, alpha feto protein level are increased. Most likely diagnosis is it is mixed germ cell tumor. Well, in the history there is a mediastinal mass is there. You always think about 4 T's: pneumonic, thymoma, teratoma, thyroid neoplasm, and lymphoma, what we call as terrible lymphoma. The 4 T's of DD of anterior mediastinal mass. Well, as far as teratoma is concerned, that is this one, teratoma. It's derived from germ cells. And anterior mediastinum is the most common area of extragonadal germ cell tumor. Point to be noted, I am talking about extragonadal. But it's very rare and usually benign. Most symptoms are a result of compression of adjacent structure. Definitely in the anterior mediastinum, we have a trachea and other structure also. So within this category of teratoma, one must also include other germ cell tumor also. Okay. So when we talk about teratoma, let's talk about more basic concept, more knowledge about teratoma. They are the germ cell tumor that contain several types of body tissue. This is one of the most important thing you got to remember. They may be made of hair, muscle, bone. So different type of cell structure are there, and that's we call as teratoma. They most commonly occur in ovaries in women and testicle in men. But remember, they can happen in the anterior mediastinum also. Now, they must be distinguished from other germ cell tumor on imaging by presence of fat or calcium, particularly in the form of tooth. So you are going for an X-ray, you are getting teeth, bone, and that means you are dealing with teratoma. They may be usually benign or maybe sometime malignant also. But as far as mediastinum concerned, they are usually benign. Now, serum hormone level may be helpful in differentiating seminomatous germ cell tumor from non-seminomatous, especially when we are dealing with testicle type of germ cell tumor. Then we have to go by hormones. Beta HCG can be elevated in 1/3 patient with seminoma, although in seminoma, alpha fetoprotein is also always normal. So it means if you have to differentiate from seminomatous, from non-seminomatous, you go for alpha fetoprotein. Okay. Now let's talk more about germ cell tumor of testes. 95% of the testicle tumor are consisting of teratomas, germ cell tumor. Okay, and most often they occur in young men. Risk factor are cryptorchism, Klinefelter syndrome are the people who are more likely to develop testicular germ cell tumor. They can even present as a mixed germ cell tumor also, and they do not trans-eliminate. That's the one point we differentiate from hydrocele. Well, we are talking about non-seminomatous form of germ cell testicular tumor include yolk sac, choriocarcinoma, embryonal carcinoma, and teratoma. Why I'm discussing these points? Because teratoma is the one thing which is common between testicle and the anterior mediastinal tumor. But this is very frequently asked question. This you should know very well. So, a mixture of different cell type are also possible and referred to as mixed germ cell tumor. And most patients with non-seminoma germ cell tumor raise alpha fetoprotein and elevated beta HCG. That's what we say there in our patient also. Now let's look into other option, high-grade lymphoma, because in these are not elevated, definitely ruled out. Seminoma, as I told you, there is alpha fetoprotein is always normal, this rules out. But let me tell you a little bit more about seminoma. More basic concept is a malignant, painless, homogeneous testicular, most common testicular tumor, and does not occur in infancy. Large cells in lobule with watery cytoplasm and a fried egg appearance. Very, very important point. Increased placental ALP, alkaline phosphatase, late metastasis, radiosensitive, that's why excellent prognosis. Well, we are getting a term called fried egg appearance. Now stop the video, write down the answer. Tell me in which hematological malignancy we in the peripheral smear you get fried egg appearance in the investigation. Okay. Well, stop the video, write down the answer. Answer is hairy cell leukemia. In hairy cell leukemia, you get fried egg appearance. Well, look into this lovely picture. This is Seminoma testis, tumor cell in lobules, round polygonal cells with large nucleus with prominent nucleoli. Septas are there. Small cell neuroendocrine tumors, they come in the lung mass. They usually are not there as isolated mediastinal mass. Thymoma, same type of picture is there, but beta HCG and alpha fetoprotein are not raised, is unlikely. Well, little bit more about thymoma. You can see thymus is there and it is coming as a mass. You can see X-ray picture of thymoma. Now I have a question for you. Stop the video, write down the answer. We are well aware that thymoma are associated with myasthenia gravis. It's a very, very easy question. But I have one more question for you. Tell me, thymoma are associated with which skin condition? Stop the video, write down the answer in your copy. Pemphigus. You can see oral pemphigus. Golden line to remember. Differential diagnosis for anterior mediastinal mass is 40s. Thymoma, teratoma, thyroid neoplasm and terrible lymphomas. 1, 2, 3 and 4. Seminoma may cause elevated beta ICG, but AFP is normal. Non-seminoma germ cell tumor have a raised AFP and they have raised beta HCG also. Thank you very much.